They are like, they're all over the map. They're almost schizophrenic on what their belief is about healthcare here. But there's one thing that this discussion points up that shouldn't be glossed over. Healthcare costs are going up across the board too much. The question is how you contain them. And the public option says let's contain them by having competition. The Republicans say let's contain them by giving more money to the insurance companies and hope for the best. This is a proxy debate in one respect, and that is that the insurance companies the insurance companies have the Republicans to the point where they're even voting against increasing Medicare benefits because they're trying to undermine the whole health insurance debate.
Let's hear from Monticello, Florida. Ann is on the independent line. Ann, go ahead, please.
Yes, there's a couple of issues I think a lot of people forgot, and one of them is that the reason that medical insurance and expenses are going up is because of all the research and development for, prosthetics and procedures and pharmaceuticals, things that we didn't have 10, 15, 20 years ago. And so that costs money, that's one. Two, there's a reminder that 80 to 85% of the American people are very satisfied with their insurance, not complaining. The remaining 5% are 5 of them of which are illegal aliens. 5% are people that make $50,000 and more and just pay out cash. So the other 5% are the ones that kind of fall in that loop where, you just don't make enough to do it, and you make too much to qualify. And so I think that all the politicians should keep that in mind, because that's a large piece of the voting pie that's going to be disturbed. And I don't think that the public way is the way to go. If you want to cut what's going on as far as all these insurances and everything going up, we just need to get government out of the way to stop all these mandates and regulations that they have on the insurance companies. There are over 13,000 insurance companies in this country, and some more will sprout up with all the deregulation. And, let them sell across state lines. Let them sell bundled packages instead of, mandated packages. And those of us out here that are paying attention, we understand this, and I don't think it's Republican and or Democrat. I'm an independent, and I'm the one who I'm going to be watching, and whoever votes for this public option and puts these restrictions on. I mean, I have 2 sons. They got to pay $6,000 a year. They're going to be flat broke. They won't be able to live. They won't be able to move out.
Caller, thanks. What would you say to Ann?
Well, Ann gives a lot to chew on, and she's built in a lot of assumptions that are just wrong. First of all, covering people who are uninsured is a relatively easy matter in all this. You give them tax benefits, you let them go out and buy insurance. The question is, will they be able to afford it? Will any of us be able to afford it? 17,000 Americans are losing insurance every single day. And you, me, Paul, we're all paying for the health insurance for city workers, state workers, federal workers, retirees. $1,000 each and every year insurance plans go up. And the idea that people are satisfied with their plan, well, that may or may not be right, but that doesn't mean that they don't want 17% of the GDP to go down to 15 or 10. We want to control costs. Secondly, the idea of getting government out of the way, does that mean get rid of Medicare? People seem to like Medicare. If Ann is not on Medicare and she sounds too young to be, have her knock on a neighbor's door and ask someone like we had earlier, like Ron, who's not 65. Ask someone who's not 65, would they like a government plan? And if you really believe it, call your congressman, if they're over 65, and say, hey, if you're against public option, like the 55 Republicans on this list are, give up Medicare. I mean, let's not be hypocrites here. If you believe the government should be out of the way, then let's get him out of the way of Medicare, a program that's worked for 44 years.
On the topic of costs, Congressman, Washington Times, Donald Lambro, chief political correspondent, writes his opinion, unhealthy smoke and mirrors. Insurance reform will cost more, not less. He writes that if you want to know how Obama's compulsory plan would work, it's now in full view in Massachusetts, where everyone is required to have insurance. There are longer waiting periods to see doctors, and costs have risen. A Rasmussen poll in June found 3 times more voters, 29% to 10%, say it has reduced the quality of medical care, and nearly 30% to 21% say it has made insurance less affordable. New Jersey, he writes, enacted legislation in the early 90s mandating insurers to enroll all applicants regardless of their health and at the same price. Its insurance premiums are among the highest in the country. Make no mistake, writes Donald Lambro, Obamacare is going to cost all of us, the economy, taxpayers, the healthcare industry, businesses, the insured and uninsured, a lot of money. more than its supporters are willing to admit, at least in public.
Yeah, but what he's ignoring is the status quo is strangling us now. It's 17% of our economy on the way to being 20%, on the way to being 50% if we don't do anything. You know, the point is whether or not whether or not we spend money for health care. It's how we spend it. Every American gets health care. The only question is who pays for it. And right now, those costs for the uninsured are being passed along to all of us. My home city of New York, $6 billion in additional taxes for the uninsured and the underinsured. That's the fact. So the idea that, okay, you don't like it because it's going to have some costs, and if you read those numbers carefully, 31% thinks the care, that means 70% don't believe the care was diminished. Massachusetts is an interesting case study on both sides of the argument. One, it showed how you cover people, showed how you reduce costs to localities because they're no longer mopping up for the uninsured, shows how you shorten waits in emergency rooms. But it also showed you one state can't compete with the insurance company. You need a true national model. That's what the public option is based on.
Moving on to Dallas, Texas now. Catherine, good morning.
Good morning. How are y'all doing?
Hi.
I have a question about the public option. Mr. Weiner said that there was 3 different public options available, and the way that the media is spinning it is that you're going to have to pay whether you want to or not. So what do you do about the people who don't have a job and then they can't afford to pay? And so I want somebody to clarify that myth for me. And my other question is that working with the DOD, our insurance was supposed to be paid up, you know, for life. Okay, if you retire early and then when you reach 65, they throw you into Medicare, whether you want to or not. Okay? And then once you get thrown into Medicare, then Medicare doesn't cover a lot of expenses that you have, what you have with the insurance that you have now. So is there any suggestions or any regulations that's going to change the Department of Defense so that we can continue to have what we have, and also my insurance with the Department of Defense go up every January and we don't even get a cost of living raise?
Thank you.
Well, you're exactly right. Look, my proposal, my single-payer proposal, would have no co-payments, no deductibles, because what we're going to do is take all the money being spent on health care in the country, administer it through a single agency, and that's where we're going to cover everyone. But the first question is a good one. How are we going to cover people who don't have enough money in their pocket? Well, we're going to give you essentially a subsidy to go out and buy insurance. But here's the important thing. That subsidy won't work and won't be enough for most people, including Catherine, if we don't have competition to hold down costs. Insurance companies announced not long ago, and you covered it extensively here on Washington Journal, they announced that their rates are going to go up 111%. They're saying it bald-faced. That's how much their rates are going to go up. So without competition, they're saying, we're going to go up and up and up. That's why the public option is so important. It's not the be-all and end-all. And most people watching the show won't be able to get the public option because they're going to have insurance either through Medicare or they're going to have insurance through their employer. Those people are not going to be able to go out and get the public option. It's only those who are not covered with insurance. So it's a sliver of a sliver. But without that competition in the public option, rates are going to keep going up for all of us.
Our guest, first elected at 1998, got the House seat vacated by your former boss, Representative Chuck Schumer, who went over to the Senate.
That's right.
9th District of New York, Anthony Weiner, Democrat, member of the Health Subcommittee under Energy and Commerce, and Springfield, Virginia has been hanging on. Jim, Republican line, welcome to the program.
A couple of points. This competition argument just occurs to be disingenuous. The government does not have overhead costs. They don't have to operate at a profit to keep going. They have proposed a plan, if I've heard it correctly, that says you pay $700 a month in a tax. You don't have to have insurance until you get sick. Well, this is going to drive every insurance company in the country out of business, and you know that to be true, don't you?
No, okay, well, Jim makes one very, very smart, good point. Yes, the government option doesn't have to make profits. That's exactly right. Why should something we develop for our citizens be a profit-making thing? If we're going to try to make profits, it should go back to the taxpayer. It should go back into health care. That's why the public option makes more sense. Now, you don't have to choose it. You can still choose to give some of the money that you're paying to executives or to overhead or to profits for shareholders, but why would you want to? But if you make that decision, that's your choice. But I'm here to represent the taxpayer. And if I'm going to develop a program, Medicare doesn't pay profits or overhead. So they have 3.5% compared to the insurance companies, which have nearly 30%. And the way the program is going to work is we're going to require people to get health care. And what's going to happen? And that's good for the insurance companies. They complain they're going to go out of business. In fact, they're going to get millions and millions of new customers. And all we're saying is if you're going to get those customers, you should compete for them. It's a free market argument.